presentations to come. I hope you all are enjoying and trying to bear with this heat in Abu Dhabi and trying to get out of the jet lag, etc. So formally we begin today's session. So before we start, I'll just read out the statements that I've been asked to. So all attendees should have received an email on 19th of July 2023 with information on how to access your online nursing continuing professional development content hours. The deadline to obtain your certificate is 5th September 2023. As a reminder, please silence all electronic devices. Thank you. So with this, we begin our first presentation by Dr. Jenneth Doria. The topic of her presentation is harnessing nursing leadership to support determinants of health. Over to you, Dr. Jenneth.
Thank you. So marhaba and mabuhay and aloha. I was just thinking, would you like to come together, or are you comfortable with where you are right now? So never has the call for ardent nursing leadership been more critical than it is now, when health inequities start to exist in meeting the demands of water accessibility and good sanitation across populations, locally and globally. Both challenges directly impact health and well-being as addressed by the UN Sustainable Development Goals numbers 6 and 3, respectively. So what I'm going to present to you today actually is more on the scholarship of application, and it comes straight from the heart. So I'm going to read this actually. I want to see what I'm presenting to you. So what is my why? I grew up in Tondo, Manila. It is a notorious place, very poor. And I have personally witnessed water and sanitation crisis, which impacted quality of life in our area and so many other places in the Philippines. We had to get up early in the morning to be able to gather water for drinking as well as for other household uses, and also some for flushing the toilet. I felt very fortunate that we have a toilet, so unlike hundreds and hundreds of families who don't have regular toilets, as well as, and they resort to public toilets or open defecation. So that's why despite this, so indeed poverty spoke to me at a very young age, such that humanitarian work has a tender spot in my heart. So I clearly discovered that where your talent and the needs of the world cross, there lies your vocation. I believe that as a nurse and as an educator, I have the power to make a difference in the lives of people across populations, especially in the country of my heritage. How I did this was through partnership and capacity building framework, where I created partnerships with schools and community leaders, as well as two NGOs, and both are based in Utah, where I live. If you look at the Philippines as well as the world, you could see the diagrams here. You know, how many of us do not, we just don't think about this, living especially in developed countries like the US or Canada or England. But the rest of the world do not have the same privileges as we do. For example, in the world, about 45% have no access to safely managed sanitation facilities. In the Philippines, it's close to about 39%, 43 million. And so the SDG goal number 6 is really, we're so far behind in accomplishing this. What I did was, since 2018, I felt that I had the opportunity to do something about this. And we have had a cluster of projects. So far, we have built 18 facilities with at least 2 to 4 cubicles. The first one is at, this one that I'm presenting to you now is at Doria Settlement Elementary School in Tarlac. This school actually is along the mountaintop, and they don't have access to good toilet facility. And the objective of this one is to foster good healthcare practices, decrease health risk, and promote well-being. So in over 18 schools, we have committed these bathrooms, and we have met that objective. We have built 2 to 4 cubicles and hand wash stations, which has impacted the lives of over 10,000 students, over 3,000 families, and 3 communities. I'd like some kind of participation here. What do you notice about these bathrooms? Okay. So what we did was we actually had the sewer system well done there, and it's the responsibility of the community to have that. And also that's a very good observation. What else? Do you see the mirrors? There's this large mirror on top of the hand wash stations. And what we have noted was that there is an increased number of students washing their hands because they want to see their faces when they wash their hands. The first one is the one in Doria Elementary School. We use the community engagement approach so that they'll be able to make their own decisions in terms of how the bathroom looks like and how they want to furnish it. But it comes with a nicely tiled toilet as well as there's a faucet, and they furnish their own pail, because we believe that there has to be a partnership. We just do not dole out the service or the facility. So prior to this, I actually followed the nursing process, which is assessment, diagnosis, planning, intervention, and evaluation. You can see these kids are from an indigenous group, majority of whom are the ITAs. They're so excited to be able to to use these facilities. The second one is actually in Bohol. We have done about 6 bathrooms in Bohol, 2 of which are in community centers. This one below is dubbed CR by the Sea. In the Philippines, we call bathrooms as CRs, for comfort rooms. And so this is actually located in an inter-island facility which connects 2 islands, the Sabinan Island and another island. But unfortunately, the bathroom that was built there way back in 2013 was damaged and was never replaced. Bohol had a major earthquake way back in 2013, and a lot of the schools were not reestablished. The upper picture there is at the Wuhan Elementary School in Tubigon. So we make it a point that we have hand wash facilities to address the WASH program, which is water and sanitation and hygiene. which aligns with the purpose of the Department of Education hygiene program. The other one is in San Clemente Integrated Tarlac, and then this one is in the Recreational Center in Lukban, Quezon. What's interesting is that this recreational center caters to about 400 to 500 families, but there's no bathroom facility on site. And therefore, they had to go towards the school, which is about probably over 300 feet, and then come back to the facility. I just want to tell you that in one of the schools in Bohol, there's no on-site bathroom, and therefore when the children need to go to the bathroom, they go home. And what do you think is the problem when they go home? They don't come back. And so this one of the great outcomes of this project is that it has reduced truancy and it has improved attendance. There's another one here at San Roque National High School in Antipolo, Rizal. And what I want to tell you is, what do you notice in the middle picture? There's actually a bidet. Asians use bidets, especially Filipinos. Because what I noted was that a lot of our schools, in fact, our school toilets didn't have clean facilities that would help with menstrual hygiene management, which is a very problematic area, especially for the teenagers, as early as 6th grade. And so we have furnished the bidets for them. So these ones, the other ones are in Negros Oriental. At this point, I just want to acknowledge also a delegation from the Armed Forces of the Philippines. Can I have you please stand? I just met them yesterday. There's Major Brigadier Doria and the others. And they really worked so hard to be able to help us. In fact, we were talking yesterday how they really stepped in and helped the Philippines in the response to COVID. The second one is our objective number 2 is cultivate sustainable partnerships and enhance capacity building through collaboration among various stakeholders. This outcome was met. So I basically created a partnership among schools, and I actually furnished the MOU with the school so that they know what their responsibility is. They're responsible for the septic tank, to make sure that there's adequate water supply, and to even offer snacks and meals to the workers so they don't have to go out, and so that they can concentrate on building the bathrooms. They know that we can build the bathrooms in 3 days. And this is made of magnesium oxide board called SIPS, which is disaster resilient. And this can be actual disaster shelters for the children in times of typhoons, severe typhoons, and earthquakes, which frequent the Philippines. So we have those from home. The objective number 3 is to create livelihood by teaching innovative building system and construction skills. And this actually speaks to SDG number 8, decent work and economic growth. This objective was met. These projects have employed over 30 individuals who have obtained temporary jobs and learned long-term marketable construction skills. In fact, we are in the process now of creating sustainable, disaster-resilient communities in the Philippines. So what are the lessons learned? Nursing leadership can bridge health inequities by supporting determinants of health. And what are determinants of health? They are non-medical conditions or factors or processes that impact quality of life. We are leaders at the helm to drive change in communities. We are nurses, we are educators, we are knowledge workers, we are change agents, we're collaborators, we're capacity builders, we are strategies. And so we have the power to leverage our roles and improve quality of life across populations. And may I share this with you, that the power of leadership is the power to influence and motivate people to change, grow, and achieve common goals. And it starts with growing and leading ourselves and extends help to others on their leadership journeys. So what does John C. Maxwell say? A leader is one who knows the way, goes the way, and shows the way. I hope to end this, I plan to end this presentation with my personal advocacy that we as nurses can actually integrate our own passion and commitment to be influencers for good. Unlike the social media influencers, we nurses are leaders who can affect change wherever we are. We are all leaders. Nurses are leaders at any point of care, at the bedside, in academia, in research. And I hope that this 15-minute of presentation has hopefully opened a little bit of that dream within you to also help others. My husband and I say, you know, we're the last third of our lives, and I want to harness my role as an educator and as a nurse to be able to lift humanity.